Protesters across the United States took to the streets in a series of hands-off demonstrations, decrying Trump's border enforcement and deportation policies, as well as mass firings under Department of Government efficiencies. In a statement released before the event, organizers said Trump and his billionaire advisor of Doge, Elon Musk, have created an unnecessary crisis under the belief that this country belongs to them exclusively. We are finally starting to see things shape up. I mean, people are taking action, they are taking a stance, and I applaud them. I applaud anyone who is standing up. They're standing for something. People are actually starting to see their eyes open now. Picture this, they're actually starting to wonder why they voted for him. I've been saying the same thing all along. MSNBC captured a clip of Kamala Harris during a speech when she was talking, and she said, listen, I'm not here to say I told you so, but she did try to warn us. I don't want to get into the politics of it, but everything that's breaking out right now, I'm just sitting back and I'm watching, and there's such a level of fear across the country. What can you do about it?
Welcome to Nurses with Voices. I'm Dr. Lendra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduced stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started.
Welcome back to another episode of Nurses with Voices. I'm Dr. Lendra. Lots of interesting things going on. So I don't even know where to start. Well, we'll start here. How about the protest, the hands-off protest? Congratulations. I am just really proud to see someone taking a stand. And people came, and if you see the videos, people came from all across the country, and bravo to them. Hands off. Hands off was about taking your hands off of our Social Security, taking your hands off of our government jobs. NBC News, let me put my glasses on and I'll read this to you. I got to put my glasses on. So NBC News, demonstrators rally in hands-off protest against Trump policies and Musk-led government cuts. Coast-to-coast opposition to upheaval in President Donald Trump's second term took shape Saturday at more than 1,200 events organized by Democratic activists. Protesters across the United States took to the streets in a series of hands-off demonstrations, decrying Trump's border enforcement and deportation policies, as well as mass firings under Department of Government efficiencies. In a statement released before the event, organizers said Trump and his billionaire advisor of Doge, Elon Musk, have created an unnecessary crisis under the belief that this country belongs to them exclusively. Well. We are finally starting to see things shape up. I mean, people are taking action, they are taking a stance, and I applaud them. I applaud anyone who is standing up. They're standing for something. People are actually starting to see their eyes open now. Picture this, they're actually starting to wonder why they voted for him. I've been saying the same thing all along. MSNBC captured a clip of Kamala Harris during a speech when she was talking, and she said, listen, I'm not here to say I told you so, but she did try to warn us. I don't want to get into the politics of it, but everything that's breaking out right now, I'm just sitting back and I'm watching, and there's such a level of fear across the country. What can you do about it? Now, some people have chosen, especially the people who have been affected, they've gotten up and they protested. Now, bravo to them. But I mean, the fear, outside of the fear, this is not the time to be afraid. This is the time to stand up and do something, whether it's joining the people who went out and protested, the hands off, or even joining us. If you're a nurse and you're listening to this, we have a march. We'll be rallying on May 20th, and we can only dream to have the same outcome as hands off did. I mean, they came from Chicago, Boston, New York, and just other cities just across the country. They came together to say, you know what, hands off. And it's right. I mean, the things that's taking place there are truly, truly unconstitutional. And we have to stand for something. And what's the saying? If you don't stand for something, you'll fall for anything. And right now we see a lot of people being quiet. But the way they came out in masses. this is how you start to make a statement. Now, we can't keep saying that there's no problem in this country, especially when we see the way the market is being touched. What's interesting is a lot of people said, oh, I had more money in my pocket when he was the president. And now they're singing a different tune. There was a gentleman who was talking about how he has to move back in with his parents. He's like 30 years old. And he voted for him because something about the last time Biden made the country such a mess. Like, excuse me, Biden, and these are facts, right? And you can definitely check me. Biden actually had one of the best economies. What I remember, and I've shared this before, what I remember when this president was in office before, I remember a country that had a pandemic. I remember a country where healthcare professionals were given trash bags or didn't have trash bags, right? You had no PPE. I remember a country that was struggling. And so I don't want to hear that, oh, when the president was in office before, you had more money in your pocket. Why? Because you got a stimulus check that continued when Biden was in office as well. And when I looked at the data, I really looked at the data and I see the economy. There was no difference in from Obama to him. Well, let's be clear. Obama had very, very, very good quarters. And yes, Trump had some good quarters, but he also had some bad quarters. I'm really trying to understand how when people say, oh, I had more money in my pocket when he was president. Right now, he's running this country like a business, right? And we're forgetting that this so-called businessman went bankrupt several times. But let me get off of that topic. Versus with Voices podcast is not a political podcast. The reason, and I've said this before, the reason why politics is something that stands out, one, because healthcare is political. No matter how you slice it, there's a lot of politics that goes on in healthcare, and the fact that healthcare is being affected right now. So when you look at Health and Human Services laying off 10,000 people, healthcare is being affected right now. The layoffs include the head of the World Trade Center health program. Now, he was just terminated, and apparently it was one of those be terminated or be fired. And I always laugh at those type of things because I can remember, and I'm gonna share a story with you guys. I can remember when I left not my last role in leadership, the role before that. So I actually left to take that role because they were paying me like something like 40K more a year. And so it was a promotion for me. So at the end of the day, I was just like, why am I making 40,000 less than what I should be making? Because at the time, I knew I wasn't making what I should be making. And that becomes frustrating too, right? So when you're a minority person of color, and I've given you guys statistics in the past on how we don't make what some of our other colleagues might be making. And so you have that frustration. Then you have the politics. Then you have just all of the other bureaucracy that goes on. And I can remember when I left, and I laugh because a friend of mine, and I'm kind of going off topic a little bit here, but I was recently speaking with a friend who he actually still works at the particular facility where I used to work at, and we were talking about one of the nurses that we were both directors, and she's at another location now. We were catching up, and I hadn't talked to him in a while. And he was like, "Oh yeah, here she's at another location." He was like, they were trying to say that they got rid of her, but then I had saw her back here, and she was working down on one of the units, and before you know it, I heard she had got promoted, and she was over at a different campus. And this is what I mean about, how people always say like, oh, you got this person got fired. They got fired. Why can't somebody just decide not to be in a situation? Like, why gotta be because they got fired? And then I can remember when I left and I went, I took this position and I left. And next, it was being said that I got fired. I was like, really? No, how about I just chose not to continue to deal with the nonsense that was going on? And so I say that to say, however, there are certain times when people do give you that option of, here you either resign or we're going to be terminating you. And then people do choose to resign. In his case, everyone knew that it was like resign or get fired. People do choose to resign for a lot of reasons. One, so they don't have the termination. I'm saying all of this to say that this particular gentleman was given the opportunity to resign or be terminated. And this does happen in leadership But in this case, I don't even know if I can really make sense out of it because, and I don't know if they knew why they fired him because now it looks like he's been reinstated. This is an ongoing saga. According to an email seen by the Daily News, the World Trade Center Health Program officials paused all enrollment and certification letters in Howard's absence as they figured out who was responsible for certifying applications and conditions. Howard may be saved, but Health and Human Services gave 16 of the program's 86 staff members pink slips, informing them that their positions will be terminated. It looks like so Howard's position was reinstated, but they still continued on with the rest of the human health and human services terminations. I mean, it's just really it's a show going on. And what are you doing to really position yourself? Well, let's talk about what Cory Booker did. Cory Booker did this record-breaking speech to talk about all of the mandates. And I'm putting this in my words. I'm paraphrasing how the president is being unconstitutional. And with the mandates of the deportations, he's not following the Constitution. His efforts to eliminate the Department of Education. Cory Booker broke the record of Senator Thurmond. He was against the civil rights movement. Interestingly enough, he actually had a black daughter, which I guess apparently was a secret. And now it's all alleged. Allegedly, he paid off the mother. It was like a quiet kept baby. He apparently had a 22-hour speech where he was against civil rights. Now Cory Booker has now broken his record with his 24-hour speech, basically trying to fight for what's right. So he's really been heralded as a hero, so to speak. Senator Cory Booker's from New Jersey, and he's been in some of the churches of some of the women that I know, and so like they're posting pictures, and kudos to him really for really trying to make a difference. And that's what this is about. It's about making a difference and standing for something, because if you don't stand for something, you'll fall for anything. And right now this country needs all of the help we can get, and I continue to push for you knowing who you are. It starts with your leadership. This is why we are doing the Leadership Nurse 201. And today is our this is week 4. Can you believe it's been 4 weeks already? So this is week 4 of our NURS 201 leadership development class. And let's see. So now you should have your leadership development action plan. We've talked about a lot over the last few weeks, and today we are just going to really talk about leadership and what that looks like. This last class is really about having your career breakthrough blueprint. And what does that mean? This is where we're really going to dive into who you are. What do you want to be? Let's start by talking about transitioning from leadership to entrepreneurship. Now, this is optional. You don't have to take the entrepreneur road. Completely optional. There's so many doors that are open to new roles now that are beyond traditional roles. And nurses are great entrepreneurs. And the reason is because our skills are so transferable. And what skills am I referring to? I am referring to our critical thinking skills, our adaptability skills, and your management skills. These type of skills is what help you transition into being a great entrepreneur. The types of nurse-owned businesses include IV hydration. You guys know I have an IV hydration business, so that's always my go-to and my soft spot. Then you also have concierge, and you can blend that. Now, my IV hydration business is a IV hydration concierge business, but you don't have to do IV hydration. So we can provide concierge services differently. I mean, I do know nurses who have home care businesses. They see patients that way. So you can provide concierge services differently. You could do private duty nursing. You could do other things as a concierge nurse. But maybe you're concierge, maybe you provide a post-op recovery. There's other things that you can do. And again, post-op recovery, that's just like providing, what do we do with our med-surg patients? Whether you're in ICU, med-surg, you've dealt with a post-operative patient. So you can provide those same skills. What are the steps? You have to think about what are the steps to take to put your business in place. Start small, right? Start as a side business so that you're not quitting your job, and let your side business replace your income, because trust me, you'll start to see a replaced income. And especially the more you start doing your business, the more you're going to start loving your business, and the more you're going to start to love the impact that you have and what the impact that you're making in the community. So you're going to start to love it. But you have to have strategy. So you have to have strategy in place. But this gives you an opportunity to allow your job, your W-2, to pay for your business, right? A lot of times people want to start a business and they need funding. So when you look at, you'll hear people say capital or raising capital, and it's because they need funding to start their business. Why not let your job pay for your side business? But this is why you start small, so that you're not just starting from bare bones and have nothing, and then you're out there running around here like you're desperate. No, you allow what you have to pay for that side business. And you'll learn time management as well doing that. We know we have time management skills because we're nurses. And just like we have to have time management in our shifts, this also allows you to set up a time management in your business so that you know, okay, I know I got to work my shifts. So this is when I can see my clients outside of here, and this is how I have to set it up. And you'll set it up, and before you know it, it's running like a well-oiled machine, and then you can actually expand it. And then the other thing you want to think about is the legal structure. And this is when where an attorney comes into play. Again, let your business pay for that attorney, and don't go and spend a whole bunch of money on an attorney right away. I'm just, don't do that. You can set up, there's definitely ways. There's SBA, there's SCORE, there's places that can help you with understanding what the business setup process needs to look like, so that you can make sure that your business is structured appropriately. I mean, there are things like Legal Shield, Inc. files, things like that. If you're just looking to get an LLC, I mean, people do that, and that's fine. Be careful when you're setting up certain businesses like IV hydration businesses, certain businesses that need particular structures in place, like the structures and we're going to be talking about this at the Health and Wealth Expo on May 15th and 16th. We actually have a American IV Association. They're going to have their legal counsel who's going to be sharing highlights and their expertise on what it looks like to really structure your business appropriately. So if you haven't already, log on and visit healthandwealthexpolive.com so that you can register for this event. It's going to take place in New Jersey. It's going to be absolutely amazing. We're going to have a vendor marketplace, but I mean, I can go on and on, so I don't want to digress. But I say that to say, make sure that you have your business structured appropriately when it comes to businesses. Now, if you're consulting and, you're doing something, that doesn't involve having a medical director and such, you're consulting, okay, fine. You still need to follow proper structures, but if you actually have a medical practice, you want to make sure that the structure is in place appropriately. So definitely consult an attorney. And then the mindset. There's definitely a mindset shift. Now, this is where I come in with my coaching, because a lot of people ask me, like, well, what do I do with my coaching? I coach more to mindset, because I've identified that there's a mindset shift that needs to occur when you are breaking through for burnout. So you'll see on LinkedIn, my tagline is nurturing nurses from burnout to breakthrough. And that's because there's a mindset shift that needs to occur. So we're nurturing you from burnout to breakthrough, because when you're burnt out, you aren't, you may not be thinking about having a business, or you're thinking about having, you want a way out and you don't know what else to do. So we help you with that. What else to do, right? I help you with that. What else do I do? But you have to also find the root cause of the problem first. You have to be aware before you can go on. Otherwise, you're just going to bring that burnout right into your business, and you don't want to do that. So that mindset piece is huge, especially going from employee to CEO. Like this, it's a huge jump. And if you're not ready for that, if you don't have the leadership, if you don't have the mindset to be able to handle what comes to you, because you're going to need autonomy, you need accountability, and you have to think like a CEO. And, if your mind isn't ready for that, you're going to sink. And we don't want that for you. And because you're thinking about brand building, because you become your brand, and there's a representation, and there's a level of flexibility. So a lot of that type A personality that you may have in the traditional setting, sometimes you have to loosen that up, and you have to become a little more flexible with your business. And there's an understanding, and there's barriers around that. You have to ask yourself, what problem in the nursing practice could be solved right through a business? And this is where that leadership comes in, because we see a lot in nursing, right? So what problem can be solved through a business? And there's your business. If there's something that you're really, really good at, and people always ask you, what is it that, how do I do this? How do I do that? More than likely, that's your business. And you have to start thinking about that. Have you ever had a job, or a passion, I should say, or an idea about something, and you put it off because of your job? These are the type of things that you want to start to shift your mindset, because if you're good at it, you're keeping away something that the community or people need. So you have to start thinking of it that way. And if leadership is something that you want to do, and you actually rather would just have more of a promotion and continue to climb the ladder in the leadership role, I will say this: be your own champion. Know your value, track your accomplishments, your patient outcomes, your team impact, build your case with data. right? Your testimonials, strategic thinking. And this is how, when it comes down time for promotion, here's my track record. And you know what? And this is actually something that helped me, because when I looked at, because we when we talk about we do all the things, right? When I look at everything that I've done, like when I look at everything, like I've done all the things: patient experience, fall reduction, opening units, or creating policies. And when you look at your track record, and then when you have someone who is just completely trying to just sabotage you, it's just like you see the writing on the wall and you have to know when to get out. You have to know when to say, like, oh no, we're not doing this. All in the name of anti-diversity. And when you see it all in the name of bias, right? Let's just call it what it is. And it's disheartening. And you shouldn't stay in that situation for a paycheck. And that's what I don't want you to do. So definitely know your value, keep your statistics, and understand the landscape. Know your organizational chart. Who are the decision makers? What's your succession plan, right? Maybe you're in a position of leadership already. Who's going to be your successor, right? Start grooming that person. Start branding yourself on LinkedIn. Like LinkedIn is a very, very powerful tool, and it's basically your virtual website. Like or if you don't have a website, there you go, LinkedIn. Let it be your virtual storefront. Use LinkedIn. And there's other things that we could talk about, how, when you talk about Facebook, TikTok, IG, like there's a breakdown on who's using these platforms. Your LinkedIn platform is definitely going to be your go-to for the more professional platform, or for networking, visibility. Definitely you can get a lot of connections on LinkedIn. You see a promotion, go for it and role play it. Something that I always did, even with my staff, when it came to like staff and patients, we used to role play a lot. And even it was funny, when I started as a legal nurse consultant, we would role play on how to call attorneys, and it worked and it helped. It did. Role playing really helps. When you want to ask for that role, or when you're going for that job promotion or going for that interview, role play with someone. It's really about preparation, so that when you go into that interview, you go in there prepared. Know who are your nurse leaders, know why you want this role, and you want to practice for it. And that's how you're going to be prepared for the role. Ultimately, you want to develop a career breakthrough action plan. And how you do that is you focus on purpose. You put your purpose into action. And what does this mean? We talked about SMART goals in one of the previous lessons. For instance, you want to apply for a nurse manager position by Q3. You have to make that SMART goal. And how are you going to achieve it? How are you going to put things in place so that you can achieve this relevant goal? We'll start by identifying your resources. Who are your mentors? Do you have, if you're lucky enough to have a mentor? What certifications do you have? What courses do you need to take? Maybe there's a leadership course that you need to take. Maybe there's a leadership program that you want to look into. Maybe, and you have to know your skills. Some people, they're natural leaders, so they don't need to have courses and such. But some people like to do it, and they like to, it just makes them feel more comfortable. A lot of organizations, they allow you to sit for nurse exec board certifications. I know that one of the hospitals that I was working at previously, they were making it a requirement for you to have a certification. And I think it was part of their magnet journey. They were making it a requirement for you to have a certification. So just looking at certifications that you may need or you may want to have. Build your support system. Who's your support system? Who's in your circle that's going to hold you accountable? The NASDAQ Cornerstone Mentorship Program, we suggest accountability partners. And accountability partners to help you stay accountable, right? So who's going to be that support system for you so that you can stay accountable? Something else that we do in the NASDAQ program is we look at your milestone. Milestones are something that you really should be looking at anyway. Even outside of the mentorship program, when you want to become a nurse manager, and we're using a nurse manager as an example, that's a milestone you want to accomplish. So you have to put these things in place so that you can achieve that milestone. How are you achieving that milestone? So once a month, what's your milestone every month so that you can reach that Q3 vision, right? What is your milestone? So you have to kind of build out, okay, what do I need to accomplish? Here's my milestone. And I do this the same thing when I build my course programs too, my digital courses. What are the milestones that I want them to achieve or that they want to achieve? So, and a lot of times this is how I know when we talk, this is how I know which program is for you. Once you tell me what milestones you're trying to achieve, okay, well, this program is going to definitely help you achieve this milestone or this leadership milestone or this. So you have to put a milestone in place in order for you to, set a 90-day goal, and each month, what is the milestone that you have to hit, and that's how you know you've achieved your goal, or you're going to achieve your goal. That's how you're on track. Actually, also a good practice to put in place in general when it comes to wanting to achieve certain goals. Put a monthly milestone. Give yourself a timeline, whether you have 90 days or 6 months. What are you achieving? Even in business, when we break up our quarter, we break up our calendar. Maybe your fiscal year is a calendar year, or maybe your fiscal year is June to June. Well, what are you doing each quarter to reach your annual goal for your profit for your business? And this is just an entrepreneur thing. And what tools are you using? What tools and templates are you using? What is your career roadmap template? Do you have a vision board? At the beginning of this year, I was invited to a vision board class, and I went, and I had, and I liked it. I put in my visions, like, yes, I'm going to have a new house. This is going to be my goal for the year. Like, I put all of these things on the vision board. It's a vision board for a reason. You want to have it, and mine is on my laptop. Now, some people, they put them in their office. Some people, they put them on their cell phones. You can put it wherever you need to put it, but it's a reminder of what you want to accomplish. So that's why vision boards are there. They're inspirational, and it's to keep you focused and keep you on track of what you're trying to achieve. Another thing is do your self-assessment. Now, we talked about self-assessments in week 1. Make sure you're doing your self-assessments, because your self-assessment is really going to help you. Where am I now? And where do I want to be? I just want to recap this final class and just talk about some key takeaways. Nursing leadership doesn't end at the bedside. It can evolve into business ownership, policy, mentorship. It can really, really evolve. Advocating for yourself is a powerful professional skill. It's backed by facts and fueled by confidence. Your career isn't on autopilot. Creating a breakthrough plan puts you in the driver's seat. I challenge you to revisit your why. What is the passion that brought you into nursing? Choose one goal from your action plan and commit to it by starting this week. And be sure to stay connected to community. Community is your biggest asset, and you have to be networking. And remember, your network is your net worth. Keep that in mind. That is all for today. I'm super proud of you for finishing and going through this leadership course with me. Tell me what your takeaways were. Let me know if you want to know more. If you want to learn more, you could definitely join us at the Health and Wealth Expo Live Summit, May 15th and 16th. And we will be in New Jersey. We'll be talking about personal and professional development, from starting a business to developing yourself personally so that you can get your mindset right so that you can move on to that next level in your career or in your professional journey, whether you're climbing that leadership ladder or starting that business. These are the things we're going to be talking about: monetizing your expertise, financial education, how to start a mental health practice as a nurse practitioner, real estate investments. We're going to be covering medical writing. There's going to be a business plan development workshop. There's going to be an HR consultant there. We're going to have a whole roundtable discussion talking about equity and inclusion. There's going to be a pitch competition so that you can get funding for your business. We're going to have a lot of education, some extensive financial education that we need to know. We want to know what's happening with our retirement funds right now. What should we be doing with it? And these are the type of topics we're going to be talking about. It's going to be such an exciting day. We've partnered with the New Jersey State Nursing Association. We've submitted for CEs, 14.5 CEs to be exact. So you definitely want to be in the building in New Jersey, Mount Laurel, New Jersey. So I call on you to be there. Visit healthandwealthexpolive.com. Again, that is healthandwealthexpolive.com. And I will see you at the summit May 15th and 16th in Mount Laurel, New Jersey. Until next time, make sure that you stay educated, stay inspired, and stay empowered.